So, good morning. This is Dr. Jacoby out in Scottsdale, Arizona. I'm interviewing Dr. Robert Parker, who resides in Houston, Texas. Both of us have had an extreme amount of uh, time doing the Dellon decompression. So, we want to talk about who Dr. Dellon is, why we learned his techniques over 20 years ago, what our experiences are with that technique, and why do we use that surgery. And for our public that's going to be listening to this, they probably never heard of a surgical procedure to help with diabetic neuropathy. Dr. Parker, welcome
Good
to the
morning.
podcast.
Good morning.
Well, you're certainly one of the pioneers with the Dellon decompression. Could you tell us how you got to become what we call a Dellonite? Somebody who understands and can execute the Dellon decompression for diabetic neuropathy.
Well, I find it very interesting since you and I have been friends for a few years that we independently found out about the Dellon procedures at Johns Hopkins through different sources. And yet we weren't 3 months apart as far as our training there in Baltimore to pick up this incredibly groundbreaking concept. And for the two of us, let's just start with the
Yeah.
simple thing of a neuroma. We have forever taken these nerves out, and then we get through this training with Dellon and realize, well, we shouldn't be removing these nerves. We should just simply be decompressing. And that word decompression isn't new to us because there was a procedure out forever that I performed and you performed with a 40 to 60% failure, and that is the laciniate ligament tarsal tunnel release. Well, it wasn't successful until Dellon came out with his publications and his brilliant research. So I was told by a friend, and you actually heard that Dellon was coming to your town, I believe, and we both independently ended up that same year, 2001, getting trained by Dellon. So this
Right.
is how I found out about it.
Yeah, and it's interesting when you really go back with Dr. Dellon. Let me just kind of introduce him. We're going to have him on the show in a couple of weeks, but his name is Lee Dellon, and he is a plastic surgeon by training, which is also interesting because he goes back to the 70s when plastic surgeons were asked with carpal tunnel, how do you fix that? There weren't any nerve surgeons at that time. They were hand surgeons. And it was divided up between orthopedic surgeons and plastic surgeons. So Dr. Dellon, being a plastic surgeon, started to work on nerves at the Curtis Hand Center in Baltimore. And he was also part of NIH, National Institute of Health. But as you and I know, he had a patient in 1984 said, Dr. Dellon, you fixed my carpal tunnel and my ulnar tunnel in my wrist. Why don't you fix my legs? And he said, well, that's a different disease. And he thought about it and went to the laboratory, did amazing experiments on rats. Now, I won't go into those experiments, but basically what he was trying to prove, the double crush syndrome that Upton and McComas had talked about up at Harvard and published in 1973 in The Lancet. Then he said, oh my heavens, there are tunnels in the lower extremity, which is surprising maybe then, but not so surprising now, that if you decompress nerves, whether it's the upper extremity or lower extremity, it's the same process. These are not different diseases. They're just called different location, different things. Carpal tunnel here, now we call it tarsal tunnel and ulnar tunnel up here. So that was an epiphany for me. I remember that very sentence that Dr. Dellon said, why do you podiatrists cut the nerve out in the foot? And the answer was, I don't know. I don't know.
And he asked me the same question.
Yes. And he said he invited us down to Johns Hopkins, which we went. We read his textbooks, read his papers, which are voluminous. And here we are 20 years later. So tell me your experience. I know what mine's been like, but tell me your experience.
Well, it's been absolutely phenomenal. And you and I have talked about the concept of looking at things through different lenses.
Yes.
The
Yes.
old saying, once your mind has a new concept, you cannot go back to the old concept. It's expanded now into that new concept. So here we were with this little world, if you will, of neuromas, and how many thousands, Dr. Jacoby, have we taken out in our practice? We've been
Exactly. And what was amazing, Dr. Thomas Morton studied at my hospital where I trained in Philadelphia at the Pennsylvania Hospital. He was there in 1860. I was a few years, I didn't know him personally, Bob, but I could have. Anyway, I was there about 100 years after that. I didn't know he practiced at that hospital, but Dr. Dellon did because he read the original paper that Dr. Morton wrote. And which is because not to put him down, he's a plastic surgeon, so he didn't really know the anatomy like we do of the lower extremity, which is an advantage because he was coming at it with a fresh idea.
Exactly.
And we didn't. And that's why we were struck by that sentence. Why do you cut that nerve out? It's the only nerve in the body is cut out. I said to myself, I know nothing. Teach me, which he did. And I think you had the same experience.
I did. And Dr. Jacoby, that he has a new book out called The Prosector, which we're going to have a really nice conversation with him. But you and I both have read the book Prosector, and that experience of the young doctor at Johns Hopkins, who became a peripheral nerve surgeon, had the same experience that you and I unveiled, if you will, as we're doing all of these procedures that were introduced to us by Dr. Dellon. And so,
yeah, same experience that you're right is that book. And I read that book. It's a great book, The Prosector, which is a person who makes the anatomical specimen for medical students. Right. And they dissect out the nerves, which you did, and I've done at Kenny Bunkport when we did the nerve symposiums years ago. So back to that concept, the I cannot see what the mind cannot perceive and vice versa. And to me, that's what Dellon did to us. Number one, producing a new way of looking at things. But unless you put the magnification on, and we use 3.5 loops, which is magnification. And when you put those loops on with the knowledge that this is a nerve compression and actually can see it, it's game changer. Absolute game changer.
Because you can actually see the diseased nerve. And then you and I have all experienced, you and I have experienced in surgery when we're decompressing that common fibular nerve, and you actually see the vasal nervorum dilate and become bright. So you see immediately, even with tourniquets on, interestingly,
yes,
you see that circulation going back into the nerve, which helps that axioplasmic flow, which is the proteins that make nerves work. Now things you can tell are going to be healthy, and that patient's going to have a good results. And then, as you said, when we first started doing these procedures, we didn't know that we were going to get the same experience that Dellon did, but we trusted his lengthy and voluminous experiments and procedures and articles, and you can't just wisp that away out of your mind. They exist, even though the rest of medicine hasn't embraced it yet. It's still.
Why do you think that is? Do you think it's because that neuropathy, problems with nerves, is dominated by neurologists? Since they're not surgeons, even if they did understand what we're talking about, they don't have the skill set to do anything about it. So they write for prescriptions, Lyrica, gabapentin, all that sort of thing. Not that that doesn't help, but it doesn't solve the problem.
You and I both know that using those medications, which are wonderful, by the way, up to this point, you cannot fault a profession that has something to help people sleep at night and live with that pain. That's been so. Again, you and I are not knocking the drug or the doctors who write these drugs, but now there's a new paradigm. We have a totally new paradigm, a new lens, as you always say, and now it's the Dellon lens. So when you finally see that, and these people respond literally crying, tears of joy, I would say, because they can walk again without stumbling. They have the burning and tingling gone. They can sleep at night. One patient of mine had 4,200 milligrams of gabapentin a day. She could not talk to me. She said, I don't have a brain. And her husband I thought he was a little quiet accountant. It turned out he was a World War II bomber pilot, but he would interpret for her because she couldn't talk to me. I did this is early in like 2002, early in my experience. She came back and literally she was off her. She was on codeine, not only the gabapentins but the codeine as well. She was off all her medicines. It sold me on Dellen techniques because that one horrible patient. And she was in my office just a couple of years ago, and she's still doing quite well. And she's very old now. She's like near 90 years old. So that's
Well,
this
we
works.
know we know it works. We got to get this message out. The world needs to know this procedure exists. We've been doing it for 20 years. Dr. Dellen's been doing it for almost 40 years.
I
I
know.
mean, I was looking at the recent statistics. Worldwide, there are 1.5 million legs amputated every year.
Correct.
So in the last 40 years, do the math. That's unbelievable. At 40 times 1.5 million, what is that? 40, that's 60 million legs.
And Rick, Dr. Jacoby, that is unacceptable. Honestly, it's unacceptable. So go back to your point there. So you're seeing the doctor who is the expert in neuropathy, a neurologist. He's not familiar with these concepts. And even if he is, as you said, with all due respect, what does he have? I tell patients all the time, I'll lift up in my office the prescription pad and say, this is what that doctor has. This is his only tool, unless and I when I came back to Houston with the training, I knew my neurologists were going to be so excited that I had this new technique.
All right.
You and I both know not all diabetics can have these surgeries. It's there's not all diabetics are compression neuropathic patients, but those who are should have, by all rights, it should have the advantage of having this to reverse those symptoms. And we haven't even talked about the statistics that you mentioned there, 1.5 million amputations around the world, and that's because those amputations are caused by constricted nerves and parts dying. And we know that decompression takes those amputation rates from 16 to 24% to down less than 4%, according to Dr. Nickerson's work. So,
Dr. Parker, you have an immense background of information. We need to convene on our next podcast. We'll have slides. We'll show the actual surgery. We'll show the physiology behind it, the anatomy, and the chemistry that how sugar causes these compressions. And then coming up in a few weeks, we're going to have Dr. Dellen on, and I'd love to have you on the show with him so we can dissect his brain to when he started the thought process of the procedure that we call the Dellen decompression. It's been a pleasure to have you on the show today. Let's get together real soon. Thank you, Dr. Parker. Enjoy your Houston sunny weather.
Thank you, Dr. Jacoby. Always enjoy it. Take care.
Thank you.